today we will talk about the basic technique of skin suturing, which is a technique that every medical officer should master. It will be important, whatever the specialty they are working, it will be important at some point in their career. So what are the things which you need for a basic skin suturing? So at the beginning, you make sure that you have got all the equipment which is necessary. So ideally, you need a needle holder and a forceps, which may be a debakey forceps, which is non-crushing debakey forceps, or sometimes you can use a fine tooth forceps as well, and also a scissor to cut the thread, and sometimes you might need a mosquito forceps as well. And it is very important to choose the proper suture material, the correct needle and the correct thread. So in the thread, of course, for the skin, you should use a non-absorbable monofilament like a polyamide. We frequently call it nylon. And the needle, either cutting needle or a reverse cutting is advisable for the skin. So as you see, this one, it is mentioned the length of the thread is 75 centimeters. It's very important to choose the correct length of the thread, and also the type of needle. This is a 3/8 circle. It is a 3/8 of a circle. So sometimes there is half a circle or 5/8 of a circle. So choose the correct needle as well. You can see that it's a 3/8 of a circle I'm using, and it is a reverse cutting needle. There, can you see the triangle here with the apex downwards, which is a reverse cutting. In the reverse cutting needle, the cutting edge is at the outer surface of the needle, whereas you get a cutting needle as well. In a cutting needle, the apex of the triangle is upwards, in which case the cutting edge is at the inner surface of the needle. So I'm using the reverse cutting needle here. And remember that during suturing, you should always wear the proper sterile gloves. In this case, I'm not using the gloves, but in a real scenario, you should always use the sterile gloves. And the holding the needle is very important, how to hold the needle. So holding the needle, I'm just showing the incorrect methods of holding the needle. So this is incorrect, that you are holding too closer to this end of the needle, which is not good, that you cannot do a proper suturing with this kind of holding the needle. And the other one is holding very close to the tip. This is also not good. You can't do a proper suturing with this. So ideal way is anterior, the 2/3 from this side, from the tip end, and 1/3 from here. You hold it somewhere here. So that is the ideal way to hold the needle. And the other thing is the needle holder should be 90 degrees to the line of the needle, like that. This is the correct method. The incorrect ones are, you should not hold it like that, and at the same time you should not hold this way as well. So it should always be 90 degrees perpendicular to the line of the needle. Then we'll talk about the types of skin suturing. So commonly used is the simple interrupted, and the number 2 is the vertical mattress, which will be used when you need some sort of tension. We will use the vertical mattress, and also we can use a horizontal mattress in case of difficult place that there's a lot of tension, like inside just above the knee joint. You can use a horizontal mattress, and also you can sometimes use the simple continuous stitches as well, the continuous without any interruption. There are some practical pearls as well we should remember when you are doing the skin suturing. Number 1 is the skin edges. When we suture, skin edges should evert rather than inverting, which will give a bad cosmetic scar if you invert the edges. So it should be always everted. And at the same time, the knots, when you put the stitch, the knot should be not over the incision line. It should be towards one side of the incision. And at the same time, you should not tighten it too much, in which case the blood supply to the edges will be compromised, and there will be ischemic edges and bad scar. And at the same time, you should count the number of stitches you put, and it's advisable to tell the patient, then he knows when you are suturing, removing the stitches, all the sutures have been removed. Let's see how to put a simple interrupted stitch. So you get the proper needle and the proper thread and the proper needle holder. Hold it in the correct manner between 2/3 anteriorly and 1/3 posteriorly, and use some DeBakey forceps as well. So this is how you put a simple interrupted stitch. So at least 0.5 centimeters away from the skin edge, you can raise the edge with the DeBakey forceps and go about 1 centimeter depth, and always take it out rather than going both sides at the same time. Take it out. Then go to the other side. Putting the knot, remember that you should not put the knot over the skin incision. It should come towards one end. So the first knot, you can go 2 throws like a surgeon's knot, but make sure that it is not over the skin incision but towards one side. And the second one, you take the other way around, anti-clockwise, and the third knot you go clockwise again. So 3 knots. Then you will keep about 0.5 to 1 centimeter length and cut the thread. So let's see how to put a vertical mattress. Like previous, you should hold the needle in the correct angle and the correct side, and with a DeBakey forceps you will lift the edge and go about 1 centimeter away from the skin edge, incision edge, and take the needle out. Don't hold the tip of the needle with the needle holder, which will blunt the tip. So take it out. Then again you will go to the other side, again about 1 centimeter away from the edge. You take it out. Make sure you don't hold the tip, and don't entangle the suture material as well. And the next one is so you hold the needle other way around, again 2/3 from the tip and 1/3 from the other end. So this one you are going the other way, closer to the skin, the incision. Take it out. So in fact this one you can go if you want both at the same time, or else you can take it out and go it again. So after that, again the same way you put the knot. For the tension, to keep the tension, you can put 2 throws like a surgeon's knot. Again the knot away from the incision towards one end, and the second knot you go anti-clockwise. Third knot again clockwise. So you can see that is nicely done with some tension, not too much. The edges should be everted, and now you can cut the thread about 0.5 to 1 centimeter length. So that is a vertical mattress.